Now that it's time to get serious about your Nclex prep, I want to show you today how nursing process and care plans applies to every Nclex question. I want to remind you that I have an Nclex study guide, keys to success, how to study for Nclex, and feel ready for practice. You can find links here below in this video. So let's get started. Here is the QR code for the Amazon link. If you're a Kindle Unlimited member, then the ebook is free. If you're not an unlimited member, the ebook is $4.99. Paperback, which is what I recommend, which is a hands-on workbook, is $12. Here's a sample question from Evolve's Illustrated Nclex Review book. A client has returned from abdominal surgery. The nurse is assessing the incisional area. The dressing has some bright red blood on it, and on closer inspection, the nurse determines that there is a loop of bowel protruding. What is the best nursing action? A. Remove the dressing and place a sterile dressing soaked in saline on the wound with dry reinforcement dressing on top. B. Remove the dressing with sterile. Apply gentle pressure to replace the exposed. C. Leave the dressing in place and apply an abdominal dressing to prevent further exposure of the bowel. And D. Immediately notify the healthcare provider and then cleanse the wound with sterile saline solution to replace the dressing. So just to quickly tie this back to my last video where we talked about nursing process and care planning and how it's a very fluid process, I just want to give you a visual of kind of where we are with this patient. So if you're going to look at an Nclex question as parts of a care plan, first is the assessment. Just brainstorm your assessment findings. What are the problems? Going back to the stem of the question, you can see for our assessment findings, this is an immediate post-op surgical patient that have abdominal surgery. There's bright red blood on the dressing, exposed loop of bowel protruding. And again, when you're looking at the problem list, it's okay that you don't necessarily know if this is a big part of the problem or not, because bright red blood immediately post-op, they didn't mention the amount. It may or may not be a significant problem, but the fact that it is bright should have gotten your attention. The bowel is exposed, the bowel is looped, which indicates that there may be a cutoff of blood supply and tissue perfusion to that area of the bowel for function, and it's protruding. So you'll want to use your care plan book. It's important by the time you get ready for Nclex that you know the most important care plans, which skin integrity is one of the most important care plans. But I'm going to walk through showing you how to use your care plan book to determine and really reinforce that your Nclex questions are care plans. So one of the care plan books that I really like most, I am not endorsed by, I wish I were because I recommend it quite a bit, is the F.A. Davis Nurse's Pocket Guide care plan books. And really the current edition is best because it's going to match the most current NANDA nursing diagnosis. But for your essential care plans, really any care plan book edition will do. So you take a care plan book and you go and look for medical diagnosis and problems, and it will tell you exactly what nursing care plans will most likely apply to your patient. So with the dehiscence, that's abdominal, you have impaired skin integrity, you have risk for infection, you have risk for impaired tissue integrity. There's also fear and anxiety and knowledge deficit related to the condition and the prognosis and what the next steps are. I would also beg to argue that tissue perfusion for the gut itself is also a problem. So as we're looking at the patient in the stem of this Nclex question, I think the highest priority here, based on just the use of the care plan book, is impaired skin integrity, because obviously something is not where it should be. But as you're using your care plan book, you always want to go to the front portion of that care plan, look at the defining characteristics, your subjective, your objective data, and is this really the care plan that I need? Does it fit this criteria? So supportive information, I would imagine that that patient would be complaining of pain, but we don't have that information in the stem. Objectively, is there an alteration in the skin integrity? Well, yes, there is. The incision is open. Is there destruction of the skin layers? Yes, something was not as it was put back together. And is there foreign matter piercing the skin or invasion of body structure? We most certainly have an invasion of body structure because this is not where the bowel belongs. So you have your desired outcomes, and I particularly like this book because it will prioritize your goals and it gives you which interventions go with which goals. So let's quickly look at the goals and just a few of the interventions to reinforce that, yes, this is the appropriate care plan. Goal and priority on this nursing diagnosis is to assess the causative and contributing factors, which the abdominal surgery itself, no matter what type of abdominal surgery, is your contributor. When you're looking at your care plan book, and the second goal is to assess the extent of the involvement or the injury. Based on the stem of the question, the extent is that the bowel is looped and protruding. Nursing priority number 3 is determine the impact of the condition. Determine if the wound is acute. Yes, there is nothing more acute than a dehiscence of the bowel. And so there's really no question. So priority number 4, to assist the client with correcting, minimizing the problem, and maintaining skin integrity at an optimal level. This is the portion of the care plan that shows you, yes, these interventions and this nursing care plan will help me answer my Nclex question. Interventions for this priority are to report the potential problem areas, handle the client gently, use appropriate barriers to the dressings, apply an appropriate dressing, and maintain the appropriate moisture environment. So let's go back to the Nclex question and see if this information has helped you answer the question. Here's the stem again. A client has returned from abdominal surgery and the nurse is assessing the incisional area. The dressing has some bright red blood on it, and on closer inspection, the nurse determines that there is a loop of bowel protruding. What is the best nursing action? A is the correct answer. Remove the dressing and place a sterile dressing soaked in saline on the wound with a reinforcement dressing on top. Every one of these interventions do take action, and I think it's fairly simple to be able to determine that either A or D were your closest options. The reason A is more important than D, yes, you are going to immediately notify the healthcare provider, but someone else can be doing that. That can be delegated. If you answer D, you would be implying that you would be leaving the patient unattended while you notify the healthcare provider. And think of all the things that could go wrong doing that. Now, I'll be the first to tell you that I am not an expert in test-taking techniques, and that is not the intent of my study guide. What I'm wanting to demonstrate to you most is that knowing your nursing interventions and your goals and the appropriate care plan is essential to you being prepared for practice. And in being prepared for practice, you're going to be prepared for Nclex. This is a perfect example of a question because it is an acute abdominal situation, and Nclex is testing minimal level of safety. So I hope this short video was able to actually show you how nursing process and care planning is in every question. Your Nclex test plan tells you that nursing process is integrated into everything. I also hope this video shows you that it is just important to know how to study as it is to know what to study. Please subscribe to my video, like, comment, all of those things. My website is keystosuccesslballard.com, and again, I'm available for individual consults. If you're preparing for Nclex now, or if you have been unsuccessful in Nclex in the past, I'm more than willing and happy to help.
Thanks for watching.